This is a news flash.
With New South Wales, and in the past few hours since we last spoke on these matters, we've obviously seen the numbers and the updated figures from New South Wales that have come through. There are 10 new cases that includes one unknown community transmission case. Further to the numbers we provided regarding Victoria this morning, where we indicated there were 3 cases yesterday, another 3 this morning. There's been a further 2 confirmed positive cases come as a result of the testing program underway. So that brings to 5 new cases today for Victoria. These 2 new cases are close contacts of the known positive cases to date. They are currently quarantining, and the number of close contacts in isolation is now over 70, and there's an extensive amount of work being undertaken by the public health team with the interviews and the conversations to track their movements and exposure sites. So in light of this new information, and also on the advice of our public health team, I'm here to advise that from 11:59 p.m. from the 1st of January 2021, Victoria will be closing its borders to the entire state of New South Wales. Now, this is not an easy choice. Closing borders, putting in place restrictions is never an easy choice to make, and certainly not one that we wanted to be making and announcing on a day that is supposed to be about celebrating. But as we've seen throughout the course of 2020, this has been a difficult year with many difficult decisions to make as a consequence of a virus that causes great damage to the health and well-being of our community. And unfortunately, the virus doesn't expire at midnight tonight, and we have to remain vigilant, and we have to do everything we possibly can to lock in the situation we have here in Victoria, keep ahead of where the case numbers might be, particularly in light of the case numbers coming out of New South Wales, and to protect the precious gains that we've achieved over the course of 2020 here in Victoria. And so that is why we are making these announcements, to say that we want to also give time for Victorians who are currently visiting in New South Wales to make it home. Now, as is well understood, the situation is in place where Greater Sydney and the Northern Beaches area are currently red zones. There's been the previous announcements that as of midnight tonight, the area around Wollongong and the Blue Mountains will also become red zones. So as of midnight tomorrow, we will be adding the rest of New South Wales, and what will take place from midnight tonight through to midnight tomorrow is any Victorians who are coming home will need to undertake a test and go into isolation for 14 days. Obviously, this is going to cause some disruption for Victorians who may be holidaying. We do apologise for this disruption. However, these, as I said, these difficult decisions are about protecting our community, protecting and keeping as low the case numbers in our community, and doing everything we can to lock in the gains we've made over the course of 2020, so we can move into 2021 and have a much better year in 2021. Happy to take any questions on this conversation.
So just to clarify, people returning, if they don't make it home by those deadlines, would they have to enter hotel quarantine?
Well, they are the arrangements that are currently in place for the existing red zone arrangements that are in place for the Northern Beaches and Greater Sydney will now apply to all of New South Wales, so yes.
And the further 2 cases, does that bring our total to 8 cases now?
Yes. 8 new cases over there was 1 previous active case, so yes, but 8 new cases in the last 2 days.
That previous active case is the one that returned the 15-year-old girl, is that?
Yeah.
Yeah, okay.
Okay.
The Premier's obviously on leave at the moment. This is a pretty momentous decision. I think it's the first time Victoria's closed its borders to New South Wales rather than the other way around in more than 100 years. Was there some consideration of him coming back to work to make the decision?
So as I indicated this morning, the Premier is fully briefed, is fully across the discussions and the decisions, and I have spoken to him a number of times already today about the information that has been coming in, the advice from the public health team, and the decision that the Coordinating Minister's Committee of Cabinet has just taken.
What about people who might be in Queensland and are planning to drive home and will have to obviously come through New South Wales?
Yeah, look, there are some arrangements in place, and there's a set of existing exemptions for people in those circumstances and in other circumstances in the case of a medical emergency or people needing to get some additional care. There are exemptions that can be applied for and put in place to assist people to come back to Victoria, and that would apply in this case. They'd have to go through the Department of Health and Human Services to apply for that exemption.
Will there be any consideration for people who might have special needs or small children about making it back by that deadline tomorrow night?
Yeah, again, that would fall into that exemption category. So there would need to be, if people are concerned about their ability to return within the timeframes that have been specified, we'd encourage them to contact the Department of Health and Human Services to talk through the exemptions that may be available and to discuss their travel plans.
Minister, do we have any idea at the moment how many people are interstate and will be looking to come back by those deadlines, if we might need more flights, or are there going to be any, I guess, extra resources put in place to help people meet these deadlines?
Yeah, look, there is, we understand that there's no doubt there's thousands, possibly tens of thousands of people who are in New South Wales. However, we have been sending a very strong message for the best part of a week and a half, 10 days now, advising people to think very carefully about their travel to New South Wales. We moved on the 20th of December around following the outbreak on the northern beaches to have that designated as a red zone, and following that very quickly added the Greater Sydney area. Just in the last day or so have added Wollongong and the Blue Mountains. And we've been saying for some time now, encouraging people to really think carefully about travelling into New South Wales, understanding that if they did and there were further cases that were coming out of New South Wales, that we would need to potentially move very quickly to close the border. Unfortunately, that is obviously where we are now, and given that we're giving this advice right now at the earliest possible opportunity, confirming that decision, understanding it does cause disruption to people's travel plans, to people's holiday plans, and that's going to be difficult for those families working through that. But it is a decision that is based on the public health advice. It's based on the case numbers coming out of New South Wales, and it's also based on wanting to make sure we lock in the precious gains and the sacrifices that Victorians have made over 2020 to see the strong position Victoria is in combating the COVID-19 virus.
What's the situation for people who might be in the ACT wanting to travel to Victoria?
We might ask Minister Foley to talk to Jerome to talk to the ACT arrangements, if that's okay.
Thank you. So we will continue to regard Canberra and the ACT as a green zone, so people who will be able to continue to travel from Canberra into Victoria, they'll need to apply for a green zone permit that will entitle them to do so.
So if they can drive through New South Wales.
That's right.
And when people return here, are they required to undertake any other action, like getting tested?
So look, I think certainly for our ACT neighbours, look, anybody whose ACT has no positive cases at this point in time, so we would be keen for them to ensure they have a green zone permit before they travel. And then when they arrive here, they obviously should continue to monitor for symptoms, and if they have any concerns, they can get tested at any of our 180 or so testing stations.
And what about for Victorians returning? Do they have to?
Oh, look, I think certainly Victorians returning from New South Wales today. In fact, any Victorian who's been in New South Wales in the last 10 days, we continue to urge you to get tested. If you haven't been tested already, then you should be, and please go and get tested immediately. If you've been tested already and you still have concerns about your health, you still feel you've got symptoms, get tested again. That's why we've boosted all of our resources at our testing stations over the last few days. Those testing stations will be fully stood up over the holiday weekend. It's really important we run this to ground now. We need you to do your bit and to go and get tested to put this thing behind us.
And just to make it crystal clear for Victorians who know now that they must return to Victoria or undergo hotel quarantine, when they get here, do they need to get tested and then isolate for 14 days regardless of the result?
So any Victorian who's returning from the green zone in New South Wales today until midnight tonight, they should get home, get tested and isolate until they get a negative test result. For any Victorians travelling from the green zone tomorrow or travelling today from Wollongong and Blue Mountains, you need to get home, get tested and isolate for 14 days. Okay.
Good.
Thank you very much.
Happy New Year.